Come and join me as we dive into the world of careers, uncovering the reality behind the job titles you've always wondered about and how you can chart your path to success. Whether you're starting out or dreaming of a new role, I'm here to guide you. Real talk, real jobs, real insight, providing career clarity, one conversation at a time. Welcome to Work Uncovered. Hi, I'm Terry Homans, career consultant and founder of Curated Careers. In today's episode, we're going to be looking at the profession of exercise physiology. My guest, Heath Thomas, is an accredited exercise physiologist specialising in physical and psychological injury rehabilitation. Based on the Gold Coast, he's passionate about helping people build strength, resilience, and a long-term health through evidence-based training. Outside of work, he trains CrossFit, surfs regularly, and is committed to living the performance-focused lifestyle that he promotes. Welcome, Heath.
Thank you.
For someone who's never heard of this role before, how would you describe what you actually do?
We use exercise and physical activity to assist people with their health journey. And that could be through an injury, such as what I work with, through to complex disabilities, traumatic brain injuries, you name it. And we would have someone assisting, through that journey.
What do you think people commonly misunderstand about this profession?
That we're a physiotherapist or we're just a gym PT.
We need to go back because I know this is, not your first career. But when you were at school, what kinds of careers did you think you might end up in?
All through high school, I was actually looking at Air Force. And it had aeronautical technician or something that I was looking at, but to go to the academy as well. So pretty much right up until probably the final year of high school, that was the plan. Yeah, it didn't eventuate, obviously, but that was the goal. That was the thought process back then.
Okay. And so what were you doing before you moved into exercise physiology?
I was doing consulting engineering. I specialized in geotechnical engineering, mainly on a sort of small scale type stuff, through residential, commercial property, testing soils for structures that would go on top or within. Yeah, that was my role for a long time. 20 years I did that.
So that's quite a pivot to where you are now. So then what originally attracted you to this profession?
I guess it was my own sort of health journey into exercise at a later stage in life. When I say later stage, it was late 30s. I think I'd had enough of the sitting at a desk, getting pretty unhealthy. Decided I needed to do something about that. And that sort of created or sparked a little inspiration in myself, I guess, about that. I got something better to offer the world, which was that's sort of my theme song, I guess. So I sort of went in that direction, more health and fitness initially. So like a PT and a CrossFit coach. The science behind CrossFit started to really tweak my interest, being a bit of a science nerd. And then my wife, who has dealt with a disorder called persistent pain disorder, had a great deal of success through working with an exercise physiologist as well as a psychologist. You just sort of put two and two together and went, well, I get where this comes from, and I think this is where I need to be. Yeah.
You mentioned that you wanted to move to something that was a little bit bigger than yourself or that was contributing more or giving back a little bit more. And I see that a lot for people who pivot later in their careers. Your values tend to change a little bit and you sort of start to look at things a little bit differently and weigh up your perspectives. So that doesn't really surprise me. So then how accurate was your picture of this role once you got into it?
It wasn't too far different. Obviously, being an EP, you're sort of working within the gym space or movement, whether that might be, like external to the gym. So maybe you're working with an athlete elderly person, quite frail. Like we can work with everyone. Initially, it was like, no, that's exactly what we sort of thought it was going to be, particularly going through uni and going to placement. It was the gym space. You train people, you give them, whatever motivation that you can sort of help. To expand on your question is, could the profession be bigger than that? And, like 100%, we're so much more important, to the general population, than just what we are perceived as. Yeah.
For sure, for sure. So you mentioned university. So what did you
Yep.
need to do in terms of upskilling or getting qualifications to step into this role?
I had to do a Bachelor of Clinical Exercise Physiology I did mine through Griffith Uni. They are on offer at different universities, but I felt Griffith was the best option for me at the time. Yeah.
Okay. What was the hardest thing you found in your first 6 to 12 months of stepping into this new role?
Yeah. So I really needed to just just focus on being an EP, rather than sort of taking on what I know, from my past experience. So just really focusing on being a good clinician for a while.
So just keeping it tight.
Yeah.
Yep.
Yeah.
Okay.
Yeah.
All
And
right.
learning it.
Sure. Is there anything that you underestimated about working in this field?
The pay is not that great, strangely enough. The income is pretty low comparatively compared to, like, someone doing a 4-year degree. That was a bit of a shock. That one in particular, that would be probably the biggest one I can think of. But other than that, like, provided you've got good support, the role itself just sort of starts to evolve and you learn it and you get better at it.
All right. Because you did quite a pivot, I know that you were pretty immersed in the world of exercise and fitness, but your actual profession was quite, very different from where you are now. So what
Yep.
skills did you have that transferred well? And then what skills did you have that really didn't translate at all in this new profession?
I make good connections with people. So
Okay.
within healthcare, creating a safe space for people, is really, really important. And creating that connection, um, is probably more important than the actual, say, exercise prescription that we do. That came pretty naturally for me, obviously from being older and having that life experience in the first place, but then also having that experience of being, say, a consulting engineer where you're dealing with different people. Um, that skill transfers fairly well into this role because you're not just dealing with a person, you are also dealing with people who are dealing with them, like manage them. So maybe, say, NDIS, they would have a support coordinator, working, contributing to their well-being that you need to then talk to. Then you've got other clinicians, practitioners that they work with, say their doctor or say their OT. And so that's that component. And the people I work with at the moment, I would have doctors, I have rehabilitation consultants, some psychologists, um, physiotherapists, OTs, and things like that. So having that skill set to be able to know who you're communicating with and know who your audience is, and then make sure you can switch one off and turn the other one on.
That makes sense because the role that you've come from, you're essentially dealing with, interdisciplinary teams all the
Yeah.
time. So just being able to manage all of those moving parts, the skill is the same. It doesn't matter what industry you're in.
Yeah. And there might be emotions involved. And, obviously I'm dealing with someone who needs me. So there's emotions involved there. And that did transfer as well. Like sometimes I'm, say, working as an engineer, I'll be working with, say, an owner. And so there's emotions connected with that, and things like that, you know. And then you've got financial as well. So people have to pay for me to help them. So we've got there's that as well. So having an understanding and appreciation for your audience is really important.
Yeah, absolutely. What did you need to learn quickly to be taken seriously in this new role? Do you think you
Confidence. Yeah. Confidence.
confidence? And that's
Yeah.
a big one. Bit of imposter syndrome happening there, or
100%. Still is. Yeah. 2 years later, still is. Yeah.
so where did you sit then behind people who came up traditionally or who maybe started out quite early in this type of role as someone coming in later in life? Has that made any difference, do you feel?
Yeah. Because I come with like life experience, right? And I come with an understanding of how health issues start to impact you, not just physically, but emotionally. And while, not personally, like haven't experienced that specifically, but people in my circle and people I know, obviously, yeah, we've had to deal with many different, health issues. They're not just health issues as well. I work with people in grief, for instance, knowing how to connect with that sort of, with those emotions, I guess.
You mentioned having a little bit of imposter syndrome. Um, and obviously, there's a learning curve no matter how great you are when you graduate, no matter, you could be top of the class, high distinctions all the way. Who or what helps you close the gap then when you step into the actual role? Um, that gap between the learning and the doing.
Yeah, hopefully you've got a good team,
Mhm.
um, that is there to support you, and you've got, someone who's going to be the person that you need to talk to. Looking at it further, sometimes it's the patients, it's the people that you're working with that are teaching you how do you do your job. And hopefully that's part of the role. Part of the role is to reflect on criticisms or compliments. And so positive and negative type stuff like that. And how do you sort of reflect on that and how you learn and grow from those experiences and that feedback.
That's great insight. I find in many of the, for ease of terms, helping professions, I find we learn tremendous amounts from our clients all the time. Just every new client brings something to you that you can just then add to your toolbox and
Yeah.
obviously your experience overall. Excellent.
Yeah.
So then getting down to the nitty gritty of the job,
hmm
what does an average day or a week look like for you then?
Um, okay. So the week I usually start Sunday afternoon,
Okay.
just making sure my schedule for the week is organized. Who am I seeing? So my service that I provide, we provide community-based rehabilitation. So we travel, to different hubs that we work out of. So either, say a gym space that's can service different people,
Okay.
um, and that. So I make sure that's all planned out. Make sure that, I know where I'm going and who am I seeing, particularly for Monday. Uh, and then, there's admin tasks that need to be done. Make sure that they're all sort of set up.
Okay. So in your role then, what do you spend the most amount of your time doing?
With a patient, either in a gym space. So yeah, working them through, say, the injury rehabilitation program, communicating, educating, and teaching them to sort of, look after themselves, I guess. So yeah, most of my time would be spent working with people.
Okay. So is there any element of time where you're sitting and perhaps writing programming or researching or
Yep.
doing your admin, or is the majority of
Yep.
your time spent actually with the client?
So I would say the majority of your time is spent, with with each patient. We get about 45 minutes to an hour with each patient. And that, so there absolutely is then time for admin, report writing, emails for, say, updates on how they're going to the team that are supporting them, which also communicates any issues that perhaps someone else may be able to help with, or do we need further support for this person? Yeah, then report writing, phone calls to the support team and the people paying the bills as well. The day in the week is good for me. I quite like it because I do get to be on the road meeting people, but I also get time and space doing my admin, which is, can be pretty easy.
Yep. I know every case is different.
Yep.
Is there a requirement to spend much time working with those other practitioners, or is it sort of, there's a bit of a brief, you might get sent somebody's files and then you just go from there, or is there a lot of sort of toing and froing between other practitioners that might be involved?
There's not a lot of toing and froing. It's mainly just that communication between the team, which within the healthcare, it's called multidisciplinary care. And it's just about making sure that people know what is happening and whatnot. It's pretty rare that I guess that we get a phone call from someone on the treating team that are like, hey, what do you reckon about this? But sometimes it happens. It's pretty rare.
Can you actually explain for people who, you've talked about that you're in the gym and working with people, helping them get over injuries. Could you perhaps give us a concrete example of what that would look like? So a type of injury and then how you manage that with a client. I'm just trying to give people a really in-depth picture of what it is that you do.
Sure. All right. Well, let's go to, because I work with both physical and psychological injuries. So
I was going to ask you that. So excellent.
Yeah. So let's work with, say, everybody knows it, say a back injury, right? So someone's hurt their back. We've got to get them back to doing and living their life and doing the things that they love doing. Generally, it's not a serious injury. So my time would be spent going, all right, how have you been feeling? What's been happening? How's your sleep? We would start talking about, say, the external stresses and things like that, that contribute to people's perception and how they and how pain impacts their life. Particularly with a back injury, because we have this sense that if you hurt your back, that's really serious. Most of the time it's not. It's just like rolling your ankle. If you roll your ankle, it's going to be sore for a bit, and then you've got some time, you've got to build back up to where you are. So a lot of education about that, this isn't overly serious. It's, it hurts. I get it hurts, but you will come out in the end of it. So then we'll work through a bit of a warm up, and while they're, say, on a treadmill, that's what we're doing. How was your weekend? How's the week been? Trying to create relationship. From there, we'll start to work on some movement patterns, do some strength movements, things like that. So that's a physical one. If that's been hanging around long enough, that becomes a psychological injury, because people feel really defeated and deflated that they're not better yet. Generally, by the time they're seeing an EP, they've been through the rigors, and we're sort of starting at the bottom again and having to rebuild possibly some poor language and messaging around that injury. So there's a lot of that going on, and how you communicate that. We don't just work with people who understand that. I could be working with someone who is a refugee, whose English is second language and things like that. So more psychosocial risk factors and things that barriers that we need to address and consider. So then moving into psychological injuries, obviously there's a range of psychological injuries, from complex PTSD, that most soldiers and people who've been to war, that's what they're dealing with. But there's also, there are other aspects of that occur to normal people who don't go to war and things like that, are exposed to traumatic events and things like that. That put them in a bit of a bad place. So then we would start to figure out what it is that they're missing in their life and what's the fun things. How do we get people seeing the joy and finding the joy in their life after having a traumatic event and then continuing to deal with the consequences of that? And a big thing is that those consequences don't go away. We just learn to adapt how to contribute to life again while that's still going on in the background. I don't think anyone fixes you. It's more about, these are the tools. When you notice that things are bad, use these tools. But when things are better, you can use these tools. So we start to figure out what's going to move the needle the most for this person today, the day that we're talking to them, the day that we show up for it.
Okay.
And so you could have a plan, and that plan doesn't work. So you've got to have a plan B or a plan C or a plan D even sometimes, depending on who you're working with. Yeah.
Excellent. So there's quite a lot of a big psychological aspect then to that. And I understand when that comes with injury. So when you're talking about that, I'm assuming that these people have some physical injury as well. I'm guessing otherwise they wouldn't be coming to see you.
No,
Am I
not
right in that?
necessarily. No,
Not
not
necessarily.
necessarily.
So,
No.
and then how do you then is it then that exercise forms part of that psychological healing? Because
Yes.
I know there's so much research around that. That's a no-brainer. But
Yeah.
so people might come to you not necessarily with any physical injury at all.
Yep. Correct.
Okay. And
Yep.
how might that work, or how might they seek you out, or how would they be referred to you if they didn't actually have a physical injury?
The work that I do, we work through, it's like a work cover sort of style. So insurance cases and stuff like that. So that referral would come through either through their doctor, through their GP. Maybe the psychologist might be able to provide that suggestion that maybe you need some help developing a routine for some physical activity.
I was thinking, if somebody had a psychological problem, why would somebody in the medical profession refer them to you as opposed to a psychologist or a counselor? But so
Yep.
what you're saying, it's more that someone there could see that exercise might be part of the answer, and that's why they come to you.
Yes.
Can you tell me then what parts of this role feel a bit less exciting?
If someone hears this and they're like, oh, I want to become an exercise physiologist. Yeah, there is admin to be done. It can be quite tedious. Yeah, let's not forget that, because you got to get paid as well. So you've got to contribute to the system. So there is stuff like that would not be as exciting that you would perhaps think, or, I'm going to spend 10 hours in the gym, and that's just my job. But 10 hours in the gym, you've got other things that you've got to do because you're a health professional. You're not just a PT writing a program. You are contributing to someone's health journey. People within that journey also need to know what's been happening. I hear a lot, quite a lot of EPs or allied health professionals that I speak with, and it's definitely some of the admin stuff that is trying to be streamlined through other means.
What types or what parts of this role tend to wear people down, do you think? Is it something like that? Excessive admin, or are there other parts of the role that might get to people?
I haven't experienced it, thankfully, but there is certainly a burnout process within allied health for EPs and physios that I know of. And it's mainly the clinic space. It's the, seeing people for 30 minutes, and you've got to get as many people as you can as possible. It's the same thing as GPs. So GPs, are ridiculously busy, and they don't get the opportunity really to see someone and contribute much. So if you do find a good GP that does take time, pay them. Don't just expect it to be bulk billed. But so burnout comes from having to see 16 people a day, 5 days a
Right.
week. Yeah.
Okay. And just not having, I've been a PT in the past, very, very
Yep.
long time ago. And I remember then also too, because you were being paid by the session, not by the hours that you worked. So you only were paid for the time that you were with the client, and the clients would be half an hour sessions or an hour sessions back to back all day long. And then you still have to fit in your admin and your programming and your phone calls and your follow-ups. And so there
Yep.
is no respite at all in between any of that. It's very dissimilar to if you were working in an office doing whatever your tasks were, and you could just get up and go and get a drink or take a 5-minute break. These types of roles don't necessarily lend themselves to that, because it's just finish, next one waiting, next one waiting, next
Yeah.
one
Next one's
waiting.
waiting.
And
Yeah.
there's no break at all in between to even just to process what you've just finished, and you're already straight onto the next one.
Yeah. Yeah, exactly. I experienced that, I guess, to a very small extent through placement at uni. I was involved within a clinic space. You could see that it can be quite difficult if there's a need to hit KPIs that, you've got to see X number of people, keep your cancellations down and all that sort of stuff. And you can see how much that would contribute to someone's mental burnout. The difference between, say, seeing a PT and seeing an EP or other health professional, we would see a range of people. We wouldn't, if you go to a personal trainer, you're going there because you want to go there. Quite often, people who are, say, injured, they don't really want to be doing this. They don't want to be injured, right? They just want to get on with their job. So that brings emotion, which you take on, like you take on that emotion because that's your job. So you do need a bit of space to digest and allow that to not get on top of you. And I'm very blessed with my role that time is given.
That's good to hear. I like to hear that. So I don't want this to be all negative, but so then what kind of person might actually struggle in this career, even if they were really capable?
You're going to be attracted to this role, to be a health professional, right? So you have a certain personality. You are quite empathetic. Because if you're not, it's not going to work, and you know it, right? So it just the way you have to be able to connect with people. And if that's not for you, then you know that that's not the right role for you. You're going to know that that's pretty quickly. From my experience coming through uni with some of say, obviously I went through uni quite late in life, but with some of the younger guys, if there's more of a, say a sporting background, or the intention is to move into more of an athletic population, I think general practice sort of EP would not be for them. It's quite challenging, because you're not working with athletes. You're working with people who are, from anything, dying from cancer, or
So can people move
or
into those specialty roles then? Are there specialty roles, EPs, for elite athletes, or is that
there are.
different kind
Yeah.
of health professional?
Yeah. So I think that the EP within the athletic population is more closely aligned to working with the physios. But then also you're looking at more performance sort of style things. So you're looking more of that sports science sort of back, understanding, which was part of the training, obviously, and whatnot. So there's certainly benefit to it. But I think, if you've got this intention that you're going to be, say, a sports trainer but better, or a personal trainer but better, then you're going to struggle with that for a while until you figure out that you're not that at all.
What kind of person might potentially do this with an idea in mind or a perception of what it is, and then 6 months in just kind of think, oh, this isn't for me? Like, who's that person? Who does that happen to? I mean, I would be surprised to see somebody enter this role who wasn't of that service-based nature of
Yeah.
giving that empathetic care. But I ask it because there might be somebody who thinks, it's like being a physio, or it's like working with athletes, and then that's not in fact the reality. So
Yeah, very, very few people, even within the physio world, like if you want to be a sports physio or stuff like that, very few people actually get to work with high level athletes.
absolutely.
And that, so, yeah, if that's your goal, I mean, great, go for it, aim high. But if that's not who you are, like in terms of aiming high and having to put in the effort and the connections to be able to get there, then maybe set that benchmark a little bit lower. Yeah.
Mhm.
Yeah.
Okay. Trying to flip the narrative now a little bit. What kinds of
Sure.
challenges are really rewarding?
Yeah. Having I guess, say a new patient comes in, having a bit of background, just knowing from communications with the team that this is going to be quite challenging. That excites me. Definitely. 100%. So knowing that 55-year-old Beth, who's never done exercise in her life, has hurt her back at work and is not interested in doing exercise, that's a challenge. So that would excite me, because that's a problem, to figure out how to connect with this person. And how do we see it's not exercise. It could be taking your dog for a walk, being able to throw the ball without being in pain. That's not exercise. That's just fun. So how do we make it fun? Because like I said, people who come to an EP, they don't want to see a PT. You go to a PT for a particular reason, like you know why you're going. You see me as a health professional, as someone I don't want to do this, but I've
Absolutely.
been told I should. So
Absolutely. It's no
yeah.
different to counselling. Many, many people come to counselling because they're told to, not because
Yep.
they want to be there. Yeah,
No.
sure.
Yeah. So we got to figure out how to get them to buy in.
What type of discomfort for you turned into something productive rather than becoming demoralizing? Just maybe, because we talked a minute ago about the challenges that energize you. Was there anything that you just thought, I'm not going to be able to get past this, or this challenge is too big, and for whatever reason you got through it and it actually turned out to be a really positive thing, rather than
Okay.
grinding you
Yeah.
down? And
Yeah. Not to do with the profession, but the moment I got the email that I was accepted to uni, it was really tough. That was a really emotional day for me at the time, because I'm like, how am I going to do this? What am I doing? I've got a family. I've got a mortgage to pay. How the hell am I going to go to uni and do all of this stuff that I want to do? How do we make it happen? And 2 and a bit years after I've done 4 years of uni, here we are. We did it.
that's a fantastic
So
example. I wouldn't have actually thought of that, because usually at the beginning you're excited and you want to do it, but you're absolutely right. There's that moment of terror of what have I just done? Like I've just quit my job. How is
yep.
this possibly going to work? So then that leads me to my next question, which is, what was the first moment when you went, this was the right decision?
So about sort of 2 months into uni, I got a text message from my old boss, who was really supportive of what I was doing and why I left. And he offered me a 6-month contract that would have been worth like $200,000 to me. And I said no.
Wow. Well, you know.
I'm not doing stuff for money that don't excite me anymore. And obviously we all need money. We all need to make an income. But I just went, no, that would be demoralizing. That would not make me feel good.
So then what feels better now than what you left behind?
Part of the reason that I got a bit off by what I was doing in engineering, and it's a phrase I use a lot, I was making rich people richer. That was the moment I sort of went, well, there's got to be something better in the world that I can be doing, that I could be offering the world, than just doing this for the rest of my life.
You talked about the salary side of this being a bit of a surprise.
Yep.
So knowing the trade-off from what you've just mentioned there, in terms of being offered, something financially quite substantial, would you make the switch again? It's the right move still?
Oh yeah, 100%.
Yeah.
I enjoy my life. I enjoy my work. I like the challenge. I understand how I want to do it. And my employer appreciates that.
I'm really pleased to hear that and that you get that support and that appreciation from your employer, especially when you've made such a big sacrifice when you talk about financially and the time that you've taken to make the move. It would be very disheartening and demoralizing if that was not the case, I would think. So that makes me really happy. How is this profession changing for people entering now, do you think? Can you speak to that at all? Have you been in it long
Um,
enough?
the role of exercise physiology within the health scheme is becoming more recognized, broadening its scope and who we can work with. I believe there's like now EPs within acute mental health wards. So within the public system, but also private, there is dedicated exercise physiologists within, say, oncology treatment, because we know exercise in general, but supervised exercise really, really helps people dealing with treatment fatigue. There's plenty of research to say that you are much better off being as active as you possibly can during treatment. I think even the survivorship is better just by doing that. So yeah, the role, it continues to be researched, expanded upon. Private entity are growing in terms of the space that they offer and that they work in and who they specialize in, but also the public space is also starting to really see the benefit of having exercise physiology within that space. Like cardiac rehabilitation is a big one, cancer space, chronic kidney disease, diabetes, having an active lifestyle and then beyond that, having supervised exercise suited to you and your individual needs. It's the magic pill almost.
I'm really excited that you say it's expanding and is becoming more recognised and appreciated and utilised more. Um, I can definitely speak to when you're talking about in oncology wards. I had cancer just over 20 years ago now. I used to go for treatment every day at the hospital, and I would go straight from treatment to the gym. It worked a treat, and it's absolutely 100% got me through. So I
Yeah.
can vouch for
Yeah.
that.
Like that's what you need for your mental health, but it's also just the physical component,
Physical
that
strength.
treatment now. Yeah. So that treatment, we know from research, just by doing that, the treatment is better, so that you have a better outcome. Plus you get the added benefits of the endorphins and that mental health component, while you're dealing with a shitty thing.
Just a bit of a question to sort of round up. Who should think twice about doing this job?
There is a personality you work within healthcare. And if you do go into healthcare with I guess, not that empathetic, being able to connect with people, there are other pathways that may be more suited to you. I don't know if you've ever worked with a surgeon, but sometimes surgeons just don't have a very good
They're
demeanor
clinical.
or that they're very clinical,
Yeah.
and whatnot. So there is a pathway there for that. But for me, for what we work with and the people that we work with, connection and being able to listen and allow them that space to tell their story and then create space for them to explore. If you're not open-minded to being able to do that, then maybe it's not for you, but that's not to say that there isn't a pathway for you
Sure.
within the
I think
space.
that's really important, that answer, though, because people might see this job title and think it's about just exercise. I would hate people to look at this profession and think, and see the word exercise and think it's about that and not really factor in that very deep human side to what you do. All right. I think that's given us a nice sort of dense picture about the role. I like to kind of finish up with a bit of a rapid fire
Yeah,
question round.
go for it.
I'll be gentle. All right. Best
Okay.
career advice you ignored at first, but then realized was right.
Oh, best career advice: follow your heart.
So you've
Yeah.
ignored that in the past and then
Oh,
realized,
100%. Yeah, of course we have. Like I think everybody has not not had the forethought to even know what their heart needs, right? So it takes time. And if you don't make mistakes along the way, then you don't really know, right? So yeah, I think, follow your heart.
What skill has helped you more than any qualification?
Being able to connect and create this space for people.
All right. I thought you would say that. If you had to start again tomorrow, what would you focus on first?
Me, more of the things that light me up, the things
I
that
love that answer.
the things that satisfy your soul. That's what you're going to work on, because that attracts, right? That's what that is then put out into the universe, and people see that. So yeah, I would do that. I would be like, follow your heart and make sure you're working on you and doing the things that you love.
That is a really valid and important point, because very often, especially when we're young, we follow careers, we move into careers or start them based on what somebody else advised us to do, or we were chasing maybe status or finance, because when we're young, our values tend to be geared a little bit more that way. How can I get in the ahead in the world? How can I earn good money? And I find that it's not until we have a little bit of life wisdom and a few years
Yeah.
behind us that we shift focus and say, no, what's exactly what you said, the phrase perfectly, what lights you up? Because then that just flows through with everything that you do there.
Yeah. So what you said there, like that was the Air Force for me. That was someone else's goal. That wasn't my goal.
So if you were giving your 18-year-old self some advice today, what would you tell them to try sooner?
Honestly, go and do a trade.
Okay.
Go and do like, like an electrician or a plumber or something along those lines for two reasons. Number one, I think you appreciate hard work, because tradies work hard, right? And they also get paid fairly well. A good tradie who runs her own business and got their head screwed on is making good money. And I say that quite often, actually, to some of the kids that I meet. Like, just, it's 4 years out of your life. Go and do a trade. Finish school, go and do a trade, and then figure out, like, what else can you do? And you've always got that trade as a backup, or as, little part-time thing. I'm going to go and do some electrical work while I'm at uni studying to find a...
Not to mention the money you can save if you decide to build or renovate anything.
Yeah, exactly. Yeah. So yeah, that would be something that if I went back to my younger self, that's what I would tell him to do. Like, go and do a trade and then figure out what lights your fire.
It has been lovely chatting to you today about your journey into this profession. I met you when you were first starting out or coming to the end of your studies, and I really, really enjoy seeing where people end up and how that journey evolves and what it looks like for them in the end. And I'm so very pleased that it turned out how you thought, and that you are 100% certain that you made the right switch. So
Absolutely. Yeah.
I'm so very pleased to hear that. And I'm especially grateful that you've come along and shared your journey today with my guests, and hopefully provide a little bit of insight for people to help them make their decisions around what path they might want to go down in the future. So thank you very much.
No worries. Thank you very much. And good luck.
Before we finish up today, here are 3 key takeaways from my conversation with Heath. Exercise physiologists are allied health clinicians, not physios or gym PTs. They use evidence-based exercise as treatment to help people recover from injury, manage chronic conditions, and improve health and function. Secondly, this job is as much psychology and communication as it is exercise programming. A big part of the work is education, building confidence, and adapting plans to the person's stress, pain beliefs, and day-to-day capacity. And lastly, the day-to-day is mostly client sessions plus travel and admin and report writing to keep the care team and the funders aligned. The work is rewarding and the field is expanding, but the pay can be lower than expected and burnout is real in high-volume clinics. If there's a profession that you'd like to hear about, please leave me a message and I'll see what I can do. If you're enjoying the show, make sure that you like and subscribe so that you don't miss out on our future content. And be sure to share this with anybody who you think might benefit from this kind of information. But until next time, remember, you can't be what you can't see, so always be curious.